Good morning, ladies and gentlemen, friends. Good morning. Good morning. It is with great honor I welcome you all for a special talk, the Survivor series, Choices You Make, Chances You Take by Murali. Murali has an MS in Computer Science from the University of Chicago and a PhD in Immunology from the University of Bombay. He works as a programmer currently, but that is just the tip of the iceberg. Murali is a real-life example of a survivor and a go-getter. A real-life example of how self-belief and positivity can propel you to new heights in spite of several challenges that you face in your life. If you are inspired by the movie Forrest Gump, you are bound to be inspired by Murali. He is an avid blogger, traveler, hiker, community workman, and many more. So ladies and gentlemen, please welcome Murali for a special talk. Murali.
Morning. Everyone hear me back there? Good. Thank you. Thanks everybody for coming this morning. What I wanted to talk to you about is my life story, but I want to set the stage for how I plan to do it. The way I want to do it is come to a voyage with me on my U-boat. So the way the U-boat works, I'm the captain, and I'll take you from point A to point B over the surface of the water. Then I dive deeper into and travel the same path. And as I dive and go down the same path, you'll hear a little more of the beauty and the darkness along the same path that I have seen, and then we'll come back up again. So that's the strategy, that's the plan. And so let's get started. So when I say old monk is the best, what comes to your mind? Okay. The choices are between these two, right? So there is old monk and there is old monk. So I guess one of the reasons I'm here also is I heard last week's accomplishment from Biocon that all of you have participated, or some of you have participated, but all of you are celebrating this whole week. So congratulations, well done. So let's consider that as the celebration that you want to do with this. But in addition to that, today I brought this because I wanted to introduce the subject with the old monk. Now, who can remember what I'm referring to? Or who can remember or tell me who I'm referring to? Sorry? Sorry, yeah, maybe true, but unfortunately that's not who I'm talking about. I'm talking about Gregor Mendel. So he is the original old monk, the father of genetics, right? So, well, that was just a joke. So let's move on. So hemophilia is a genetic disorder that passes down because it's an X-linked recessive genetic disease identified a couple of decades ago and known thousands of years ago. But in my case, there was no family history, and I was born in 1960 and not diagnosed until the middle of 65. So about 4.5 years of age, I was diagnosed. So what is hemophilia? Just a quick, all of you are scientists. I'm not going to go into the science. That's one more thing that I wanted to tell you. This is not a science lecture. This is my life story with tidbits here and there about the science, so that some very few of you who are less familiar with hemophilia and the clotting cascades and all that get to see this. So I won't spend more than 5 seconds on this. So that is the diagram for the clotting cascade, as you all know. Probably some of you have studied it in college. And then there are 13 proteins, which are in general called factor. So factor 1, 2, 3, 4, they are listed in that table there. So they all, circulate in an inactive stage, and they are activated as you go along the cascade, and in the end form the clot for normal people. In my case, factor 8 is missing. So a little more details on the factors themselves. So the predominantly noted factor deficiencies are factor 8, 9, 7, and 1 Willebrand factor. So, and then also the hemophilia is classified based on the percentage of factor in circulation as either factor 8 severe, factor 8 mild, factor 8 moderate. I happen to be factor 8 severe, which means I have less than 1% of circulating factor. The normal range is 50% to 150%. So I have effectively no factor 8. And that, therefore, the cascade doesn't flow, and I have hemophilia. What kind of symptoms? You can tell is obviously no clot, lots of bleeding, and the bleeding happens externally as well as internally. The seriousness is more on an internal bleed, only because on an external bleed you can apply pressure. You know exactly where you're bleeding. Like you have a shaving cut, you know where to put the pressure, it stops. But internally, you do not know, and therefore all the symptoms. And joint spaces are the most commonly affected, as you can already tell from the way I climb the steps. Abdomen, GI, so abdomen has a lot of space. The hip, a lot of space there. Intracranial, of course, muscle bleeds and soft tissue bleeds. The bleed can happen either due to trauma, some kind of injury, or it can happen spontaneously. I have had, cannot tell you how many times I've had spontaneous bleeds during exam time. I studied here. So you can, like always, that May, June comes, I'm just sitting and studying, and spontaneously there will be some bleed in my elbow or something. I'm not done, there's no injury. So that is common. The disease itself, or the deficiency itself, is clearly not treatable because it's a defect in the lack of protein here. But the correction happens with an injection, an IV injection currently, of the missing protein. And that is how it is corrected to a normal level. But then we are dealing with half-life of a protein, so you have to continue that infusion as and when needed. So we'll talk about that in a few minutes. It's always been known to be a male disease until more recently, like in the last 10 to 15 years, lots of women have been identified and are coming out with bleeding issues. Nosebleeds and other bleeds that we are all familiar with have been, and they have been diagnosed, and they are also getting the same treatment as the men. So it is not a male-only deficiency anymore. So let's move along with my life again. Primarily in the early days, the treatment was RICE. So rest, that's the acronym for rest, of course, rest, ice, compression, and elevation. There was no factor in India 50 years ago. And that was what, and then on diagnosis, the letter says, make sure you test all your family members, because on a traumatic bleed, when you have to infuse whole blood, that is the only source of the missing protein that was available in the 60s and in the 70s. In the late 70s, I had an accident, and this was a significant life changer for me. We'll get it once we dive. We'll go through some of the details of that. At that time, the standard of care moved or was upgraded, and this became available, what is known as cryoprecipitate, which is basically a fast frozen plasma, and had concentration of von Willebrand factor, factor 8, and primarily factor 8 and von Willebrand factor. That year, of course, after that accident, I missed a year of school. That was the time for me to introspect and think, okay, I'm going to come out on the other side. I hope I will be able to walk someday, and let's see what I can do at that time. We'll figure it out at that point. That 1 year period, I grew mentally and physically to a point where I had to decide, am I going to let this go and just give up, or move on and see what I can do with what remains? And we'll get into that also in the next round. Okay, so obviously, clearly I moved on because you got the introduction. Thank you, Arvindam, for that. Where I went on to do my master's in microbiology, and also worked with Naren. He was my senior in Cancer Research Institute in Bombay. Somehow, got my PhD. And let me tell you one thing: a PhD was not just heads down doing research. Honestly, we were spending 10 hours to 12 hours a day because we had to wait for samples and things like that, and we had a lot of fun. Those 5 years of was really both enjoyable as well as I did a lot of cultural activities, hikes, treks, made fun of our advisors on stage, and so it was fun. We had a lot of conferences where we had put up cultural shows and took that opportunity to hit on some of our professors and their mannerisms. So it was good, and and Naren can give you all those more details on that. So moving on, 89, I finished my PhD in August and applied overseas and within India, and went to the US. I don't know if Naren, you remember, but I had two postdoc positions at that time. One was to work in the same lab as Naren, and then so I was talking to him, STD or whatever long distance call, and he actually said, well, for this amount of money, New York is going to be too expensive, take the other position. And that's how I ended up not working with Naren again. So, I moved on to Milwaukee, Wisconsin, where I did my postdoc. And then, postdoc means you have to, after a few years of postdoc where you're funded by your advisor, you got to fund yourself. So there was research grants, but simultaneously the standard of care after moving to the US became significantly different because cryoprecipitate means 3 hours of IV drip type of 3 to 4 hours of IV drip. This was 10 cc's of monoclonal antibody purified factor 8, which I had to go to the hospital, but it was much simpler at that time. So, and in 92, the first recombinant factor 8 became available, and so that became my standard. One thing that was different was until about 97, I was working in a research lab. Therefore, I had the doctors who I was training, the technicians, they would infuse me. So they would give me the shots. And I never learned to take my injections. These were IV injections. I never learned to do any of this by myself. And the doctors would help me out. It worked very well. But then what happened was, in 97, I gave up everything. I just quit. And I'll tell you later why I quit. And I went back to school. Now, who has seen Rodney Dangerfield in Back to School over here? Anyone seen this movie? If it's not, I highly recommend. This is a fun movie to watch with Rodney. His son goes to school. So, and he is a spoiled rich kid. And so the father goes to school with him in the same school, and competes with the sun. It's a fun movie to watch. So I went back to school at a much later age in my life, and I went to University of Chicago, and there it was, so from Milwaukee, when I moved to Chicago, I had nobody to infuse me. So I had to learn to infuse myself. And I obviously, the bleeds continued. So this is me infusing in this picture. So, and then, of course, after I graduated with a master's in computer science, I worked as a developer for 2 years, and I'm a database administrator for almost 17 and a half to 18 years now. So that is the whole life story. Now, what I do, once I got up to the stage of having good recombinant, purified recombinant factor, I felt safe. I felt very safe. That being a scientist in my previous life, I was always afraid that infections could come through the carrier protein, the stabilizers that are used with these molecules. Thankfully, I did not have the infection. In the 80s, thousands and thousands of patients with hemophilia were infected with HIV and hepatitis C in the US. I was here. I was not getting treatment. Cryoprecipitate was once a year when I got it. Blood transfusion once a year when there was an external bleed of some kind, or when knee bleed. So I did not get infected with any of these. So I escaped that. So I always started, I became very thankful for what I have. The other thing that is almost, it's a curse on patients with hemophilia. The body reacts to the infused factor. So these are high affinity IgG molecules that as soon as you inject your factor, that pulls it out of circulation. So to overcome that, you have to infuse 5 to 6 times your normal dose. So that is very, very difficult to live with. Not only you have to infuse a higher dose, but you also have to increase the frequency at which you dose factor. It makes it. So I started to realize that, okay, I don't have inhibitors, makes a big difference, and thankfully I don't have any of these infections because I did not get treated. But clearly there is a downside to all this. And the downside is I did not have treatment for 29 years. How did I manage? How am I still living and standing and go around? I had bumps and bruises all the time. I had nosebleeds. Nosebleeds would be just stuff gauze, stuff cotton up your nose. And then what happens with these things? At some point, these gauze and cotton has to come out, right? You can't be just, you're breathing with your mouth open day or night. It has to come out. And when you come out, the clot breaks. You start bleeding all over again. So that was my life for the first 15, 20 years. You're in school, you miss school. I had a bad lip injury. What happened? Many of you are much younger. It probably doesn't happen anymore. Some of you would remember in these societies, they used to show cinema. They used to show movies where they had a big screen tied down to stones with ropes on the ring, and that at 7 o'clock or 8 o'clock, you would start the movie. Some old movie, some Dharmender movie. And so I would go home, eat quickly, and I would run. I would run because I was a big movie buff, something that I could do. And when I one of these times, when I ran, I tripped on the wire that held the screen. It was dark already, and I fell on gravel. I still started to continue to run, but then I started to drip. I had cut my lower lip, and that was just gushing. So, sure, no movie. That's the bad part. I was just like disliked. Oh, I missed a big movie. So I obviously went home. This is in the 70s, in the early 70s. Parents put the gauze. That was, just kept dripping after that. Went to the hospital. This is Calcutta in the 70s. Who can remember Calcutta in the 70s? Anyone? Hands? Calcutta in the 70s, the big thing was the Naxalite movement. Every other week, there is a strike. Somebody or the other goes on strike. This time, by my good fortune, bad fortune, the doctors were on strike. I'm in the hospital in a room with 15 other or 20. It's like one of those, I don't remember what it's called. It's like a big hall with beds. And all the kids were there. No doctor to treat me, and all this gauze and everything hanging off of my face. That was just how these things were those days. And then eventually I got stitched and things were good. Moving on to the knee injury. Now the knee injury, how did that happen? I have a brother. You'll hear more about him in a few minutes. And two brothers, of course, we have to fight. So running around in the house, I slipped on water on the tile floor, and if you remember in those days, I don't know if it's probably still there, the refrigerators were kept on top of a little stool type of thing. My leg went under there. I slipped. My right leg went under there, and of course the fight stopped. Then, but that's the end of it. That's the end of my knee. And we were living on the 3rd floor at that time. This was also Calcutta. So these were how things were. And I was in plaster for a month, and obviously means missing school and things like that. Let me go to the big life-changing event that happened. 78, between class 11 and 12, in the monsoons of Calcutta, I had a fall. I cannot really remember, but I think I must have fallen off of the hand rickshaw. Whoever has again been in Calcutta in those days, I don't know if it's still there, but those hand-pulled rickshaw, trying to climb on that, slipped, fell down, still went to school or wherever I had to go on the rickshaw. I continued to, do my cricket and playing and things like that. Unknown to me, my hip, I must have had a hip bleed. About 4 or 5 days later, I started to lose color. And I started to feel some pain, and I became breathless. First diagnosis at that time was jaundice. It was monsoons, everything fitted, and I was losing color. So the doctors, they took me to the hospital. They said, your hemoglobin is at 6. So I must have passed out of that, and of course a lot of blood transfusion those days. And then I was in Calcutta. My parents were in Bombay. Father had a transferable job. He found out through some doctor there that Haskins Institute in Bombay had cryoprecipitate. That was how I got cryoprecipitate. So eventually, of course, the clot resolved, or rather formed, but it impinged on some nerves going down my right leg. And that caused a lot of pain. I dealt with it. That was the year I missed school. 12th standard I missed for that 1 year, because a couple of things happened. So I had so much pain. I went on Proxivon, was the only solution for me to control the pain. I was popping pills, 1, 2. Without that, I couldn't sleep. So I did, and then what happened was 3 or 4 months later. So and the nerve damage also caused, some level of paralysis. I was just not able to walk, and I was moved around in a cane chair inside the house, taken to the bathroom and things like that. So that's how life was for that 1 year. I was paralyzed on my right leg, not able to put any force on it, and I became addicted to Proxivon, even when there was no pain. I would be up at 1 o'clock, 2 o'clock, saying, sleep, 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 and nothing would happen because I had stopped taking the medicine. And then I would take a couple of them and sleep for 3 to 4 hours. During the day, I somehow managed because there were people around and I had friends would come by. But that is how that 1 year went. And that's when I started to think, I did not know how I'm going to come out on the other side, whether I was ever going to be able to walk. Eventually, with all kinds of Ayurvedic massage and physical therapy, we had moved to Bombay, obviously. And then walking on the beach was how I survived. I started to walk, with some help. I was able to walk on the beach in Juhu and in Chandan, there's just another small beach there. And that strengthened my right leg. The downside of all this, I went back to school, etc., but I developed a foot drop. Now, foot drop means, just to explain that, the feet are usually, everybody's feet are in one position, normally. When you get a foot drop, one foot drops. So my right leg, because of that nerve damage, has dropped. And that created a significant problem, because when I went back to college and things like that, you know how things are on the when you walk on gravel, right? There are those tiny stones and pebbles on the street that you're walking normally, but that little, half an inch of height, I'm on the floor. I hit that when I walk. That is just how life was. I'd fall, I'd get up somehow and move around. But then I went to do my master's and my undergrad and grad school and things like that. But that is just how I walked for the rest of my life. I have a foot drop. I still have the foot drop. So that cannot be corrected. All my joints started to naturally fuse because of the amount of bleeds that I have. So my right leg is fused this way, the ankle is fused this way, and the left ankle is fused up. And that's just how it is. Nothing can be done with them other than break them and then fuse them correctly, which is, again, major surgery. A few different surgeries that I had. My diagnosis was done at a tonsil surgery in Vellore. And I bled for whatever number of days. And fortunately for me, a visiting doctor from the US identified that this is possibly hemophilia, since there was no family history. Then I had these two other surgeries. One is a pseudotumor. For people who do not know what a pseudotumor is, it is okay. Pseudotumor means obviously it's a fake tumor, but it's not a tumor. I did not have a. So that is the name for a blood clot inside that grows, and that grows because it becomes vascular internally. So it's like a balloon, and that balloon, because of the bleed in the vessels, in the capillaries that are inside the large pseudotumor, it basically expands and it just grows. We'll talk in a second about that. I had a kidney transplant 2 years ago. Coming up on Sunday, I would have been transplanted 2 years. So it's my second anniversary coming up this Sunday. I am considering a total knee replacement. The doctors are pushing back, saying, hey, live with your original parts as long as you can. Don't try to do this. There are reasons for that too. So the pseudotumor. So as I've already described that, this is the effect of that fall that I had in 78. What was a lemon size in 78 had started to grow to these sizes. As you can see, they started to, there was, 14 centimeters is about a half a foot there. And it progressed to a point that in 2003, the doctors finally said, okay, well, we waited, you're doing surgery, especially removing a clot that is vascular. I mean, who wants to do that, right? I mean, you have hemophilia. So surgery was avoided for more than 20 years. And then they said, the organs, so it was on my right hip. So it is sitting right here, and it started to grow up. And it came up to the ribs from my hip. So you see, it's about a foot. And just for all the ladies, sorry, but it's like carrying your own baby that was growing. So that's how big it was. The surgery, even in the morning of the surgery, the doctor said, hey, you can back out. The reason I agreed to this was the forecast. The forecast was the organs were getting pushed to one side. The clot was growing so big, the stomach and everything. I'll show you a picture in a second. They were pushed to my left, and the doctor said, you can live with this for, who knows, 3-4 more years, but then they're going to pressurize your organs, your spleen, and maybe even your kidney and things like that, that it's going to start, you're going to start seeing organ damage. I said, okay, I'm going to take that chance. So in the morning of, I signed off on the surgery. My parents, my brother, we were all here back in Chicago, and they did it 5.5 hours of surgery. I came out good. Everything worked. So I had the good fortune to write this case report with the medical team. So Dr. Valentino is my doctor, my hematologist. So this is, so now I can, this is the pre. This is how it was. This is the mass itself, or part of the mass. This is all the things. And then this is the scar, about 14 inches long on my right side, all this. So this was the mass on the MRI that was, and then this is after the surgery. So the mass was gone, and things were hugely better after that. Coming on to the kidney transplant. Now, why did I have kidney disease? There is no connection between hemophilia, at least no known connection between hemophilia and kidney disease. Here's what I believe happened. In the 60s and the 70s, first I was misdiagnosed. I was considered, the bleeding was considered rheumatic fever, which they gave things equivalent to aspirin, which is a no-no for hemophilia, because it's a blood thinner. There's that. So there's that. And then, there's all kinds of treatments when your parents are, people are advised. They say, okay, take this, homeopathy, that'll cure this thing. Go to this person, go to that person. Go to this temple. Go to these series of temples. I cannot tell you how many movies I have seen in the, when I was 8, 9, 10 years of age, where you would go to this Murugar temple movies where all kinds of lights will come and you will start getting sight. I was believing in all those type of things, that someday this would happen to me also. That when there was no treatment, you believe blindly to everything. And that was just how it was, 15, 20 years of my life. And all kinds of medicines, painkillers, Proxy-1 probably contributed to killing the kidney. And the kidney damage continued to happen. 2 years ago, it got to a stage where the creatinine, I'm hoping, some of you are familiar with these numbers. Anyone with kidney disease or having family members with kidney disease in the audience? Okay, so yeah, hemoglobin back down to this, take your erythropoietin charts. None of these times I missed any work. Thankfully, I had already moved on to IT, and I could do my work from home, from work, from a McDonald's, from a Honda dealer, anywhere. All I needed was connectivity to the internet and my laptop, and I could perform whatever I had to do for the day. Potassium was heart stopping, greater than 6. I got a call from, I'd gone for routine labs, and I was a big banana eater, 2 to 3 bananas a day, and that kicks your potassium. And in a half an hour, the ER calls me saying, "Hey, we need to check your potassium. If you delay it by half an hour, your heart will stop." I said, "I never heard of it," but so I had to go to. So these type of things have happened. There are lots of things. And clearly, with kidney disease, you have all kinds of diet restrictions. So here's the transplant. That's my brother. This was about. Okay, well that's my brother. He was my donor. We were a match. So within about 6 months, we scheduled the thing because I was on the verge of dialysis. I was If that was how it was, if he was not a match, I was on a transplant list, but then the wait was 5 years or on average, which could be in lifelong. So that's just me 2 hours after the transplant. My brother had already recovered enough to walk to the room, and that is the ultrasound of my new kidney right there. So yeah. So coming down to total knee replacement. So the normal knee has the space. This is a stock image. This is not my knee. And then you start losing this joint space, and your knee does not bend anymore, or the terminology is bone on bone. And those are images of my knee in October this year. So there's really nothing there. The kneecap has moved off to the right on my right leg. That's the kneecap coming out on this side, because you don't see the kneecap. It's right behind, or right in front, whichever way you want to see it. And it's the front view here where you can see the kneecap. Left knee is equally destroyed. This is a side view of. So here's where things stand with my knee replacement. I went to the doctor after this, and the problem that they are facing, or the recommendation to keep the original body parts in, is because I have nerve damage and I have a weak right leg. The problem with that is, you get a new knee, the knee starts functioning very well. But then with weak muscles and weak, the damaged nerves, your knee, if I was climbing these steps without any support, my knee is likely to buckle, because it's a good knee. It's a better knee now. Arthritis now in the joints has come to my rescue. So the message here I'm trying to convey here is that, yes, there will be some problem or the other that is going to come in your way. It is your experience that will automatically guide you. First decision is you have to take a decision on, okay, you want to move forward or you want to succumb to this. If I had to succumb to this, then the show is over. If I have to come around and figure out a way around it, then I have to put in some effort. So that is what I'm doing right now. I have all kinds of orthotics and things like that. I can show you that is letting me stand and talk to all of you. The damage from living with hemophilia, arthritis, we have seen that. Then joint nerve damage, decreased range of motion. My knees will not bend. My elbow will bend up to this. All things like that. So, and many of my joints are fused. Thankfully, my hip is still good. Emotional toll is the big one. And this is very, very common. And it occurs to me all the time. And Kriti, you were asking me, why, or rather I was telling you why I would not dare to walk on carpet, because even, with the cane. What has happened in the past is, because of that foot drop, I have fallen down so many times that I have PTSD in my head. PTSD, as everyone knows, is post-traumatic stress disorder. It bothers me to be walking on carpet without any support, even if I'm at home. I don't need, I can walk up here. There's no issue of doing that, but something on the carpet, I would definitely want some form of support. And for the longest time, I used to walk very close to the wall so that I can, restrain myself from falling, because if I fall down, I have difficulties getting up. OCD, I am so nervous if I have to, do something that I'm very, very picky, everything has to be in order. And that's just how it is. Depression is something that I have not encountered, but it is very, very common in the hemophilia population. Of course, anger. Anger is there everywhere. When you're restrained, you're tied down, like 3-4 days, everything is normal. You're functioning, you went to work, you went to school, you went to the movies, you went to socialize. Snap, you have a bleed, and then it's life changes. And this happens frequently. So my attitude has changed to anticipate some issues coming down the road, even if things are your normal right now, and the normal changes pretty much week to week to week. Learn to adapt, because I have decided that I am not the one to sit back and let hemophilia rule me, because then you can give up. I didn't have to come this far in my life. I have certain goals that now I have to accomplish, and that's what keeps me going. So I adapt, and then some of the downfalls and downsides of this I accept, because if you cannot fight it, might as well accept it, because you'll be fighting all your life. These things are not going to go away. You're not going to be able to figure out an alternative, because if you had, your experience would have already given you the alternative. So you have to figure it out whenever there are any new challenges. That's what I do all the time. On the medical side, because of lack of exercise, because of that PTSD and the fear that has been with me all this time, I'm very careful about what I do as far as exercise, and because of that, my bones have become weak. That is one. That is due to the hemophilia, lesser activity. The other thing is kidney disease takes out calcium from your bone. So I've had that for 30 years or more, and so there are two reasons why in my 50s I've been diagnosed with osteoporosis. After the kidney transplant, it's a known thing, 1 out of every 3 patients. I do not have a history of diabetes in my family, but now I have a low-grade diabetes, and I've started taking treatment for that. So living with hemophilia now, everything obviously goes back to hemophilia, which I've already explained why, and has led to these. I don't know what else is coming up. I will just have to adapt to that. That is just how it is. But my work and my goals, I'll come into that in a minute or two again. I'm not going to give up on that. And that is what motivates me to live day by day and continue to. Hemophilia and kidney disease, I have treatments for that. I'll continue to do what I have to make sure that things are stable. And I'll stay focused on my day job, my family, my friends, my social activities, and anything else that I like to do. So that comes to how have I managed all these years. I only have my family, that's my parents, my wife, my son. There's a small picture of all of them. Oops, sorry. There's a small picture of them. This is like 5 or 6 years ago. This little boy, he's not little anymore. Maybe that's more than 10 years ago. So my parents, my wife, that's my brother, his wife. So this is basically the entire family. And she came along later. This is my brother's daughter. She's almost 10, 9.5, 10 now. And this is my family group, friends group back in the Chicago area. So we get together very frequently. They have kids, so it's a lot of fun. So life continues. My colleagues at work, they're extremely supportive. Everybody, I have never concealed my hemophilia, because it does not help. If you have a problem and you have concealed hemophilia among your coworkers and you need help, who do you go to? At that point, you're not going to be able to train anybody. So that has always been my thinking, because these problems of bleeds and injuries happen without any warning, and they can happen at any time. So, and then I am quite connected with the national hemophilia chapter foundations in Chicago, and now I'm starting to get connected with the chapters and the national organization is in India also. So now I've talked about hemophilia, my work. What do I really like to do? I like to travel. I like to go see places, new places. My wife and I, we travel once or twice a year. Recently, we went to Alaska in September. And if you could dim the lights, please. Okay, never mind. That's okay. Well, just wanted to see if that can be. If it's not convenient, that's okay. That's okay. So I like to watch movies, go for plays. We do go for plays. Of course, watch a lot of football, American football, because there's not a lot of soccer in the U.S. Like to take pictures with my phone. I have, many years ago when I couldn't afford it, I used to borrow cameras and take pictures and print them. As far as therapy, the only thing I do is lift light weights. Use the stretch band, do light range of motion exercises. I use the pool a lot. So that's the pool that I go to. There are back there, those dumbbells. These are foam things that I push underwater. So they are the opposite of weights. So weights you lift up, and you lift up whichever way, whatever you want to do. This is foam. So you push under the water, gives you the same resistance, but you can move them slowly. The water gives you sufficient smooth resistance that it's not jerky, doesn't cause a bleed. So these are the adaptations that I was talking about. The reason for doing all this is, without these, my muscles or range of motion would not be where I am now. So anyway, since we are, can anyone tell what this is? Oh my goodness! Everybody has seen Northern Lights. Beautiful. Yes, we have good fortune in September to see the Northern Lights in Alaska. That was the main focus of that trip. It was really nice, and this is also another panoramic view of a beautiful lake. I just thought I'd throw them in to display some of my small photography skills here. The other important part of my life outside work and is do fundraisers for hemophilia organizations, promote corporate donations. The other thing that is very, very important, especially for India, is there's a lack of diagnosis here. About 15 to my understanding from talking to the chapter heads, is the diagnosed population is about 15 to 20%, which means 80% of patients with hemophilia, whether it's 1 millibrand or 8, 9, 7, 1, 13, they are walking around among us in this country not knowing that they have a bleeding disorder. And there's a lot of taboo happening here. I was at the chapter yesterday in Bangalore in Victoria Hospital, and I heard some of these things from family members that people are being sidelined. So the other thing that is missing in this country is factor. It's a very, very expensive product. In my case, in the US, health insurance pays for factor. So I can consume, as indicated by the doctor, any amount that I need by day, by month, by week. To give you an idea, 1 month's worth of factor for me, which is shipped to my home, which I self-infuse, is $50,000. That is the cost of factor I infuse. This is just on a regular month. If I had surgery, clearly that is going to be more. It could probably up to 50,000 in a couple of days. So it is a very, very expensive disease. So what I do is I solicit factor donations. People have factor with them. And people, some of these patients, because of their teenage years or whatever, they do not infuse as indicated. And they have factor lying around, and they expire or they're almost expired, and the next month they get their new supply. And it just, old supply just lies around in the back of a refrigerator, in their garage or somewhere like that, and they just get old. I just ask them to donate to me, and then I bring them here, and I carry them myself, and then give it to the chapters for free, obviously, and they give it to the patients. The problem I have seen here is patients, because of lack of health insurance, have to buy factor. And they buy factor only as much as they can afford to, clearly, and they cannot afford much. I have talked to families where a month's salary for the dad or the mom is 1 dose of factor for the patient. That is how bad it is. So those donations help. In addition, I have participated as a patient advisor on new products, do a fair amount of community speaking, but not to a big crowd like this. This is a beautiful crowd here. So, smaller crowd. And then the last and most significant thing that I do is go to Capitol Hill, which is our Rajya Sabha, and talk to the senators over there, or your MPs, along with a group of other patients, asking for funding for hemophilia and promoting support for them. Coming to India, that's what I do in the US. In India, same thing, over Skype, over WhatsApp, over the phone. I talk to the chapter people, try to consult them, because share my experience. Basically, that is most important for me. That what you are seeing now, the patient is likely to have greater problems. Try and prevent it now when he has lesser problems, because I have seen the progress of my joints and my disability over the years. Finally, or kind of starting to come back up and wrap things up over here, I track hemophilia treatments. That has been very, very important for me to track ever since in the gene, factor 8 gene was described in 1983 when I was in my PhD. I've been following factor 8, factor 9, the gene identification, and the progress all the way up to recombinant factor. So what is in vogue now for the last 3 to 4 years is based on PK. We all know what PK is. We are all scientists here. So factor 8 has an average PK of 8 hours. So the half-life is 8 hours. So with the extended half-life that was introduced in the market 2 or 3 years ago, there are 2 of them that are in vogue now. There's Eloctate and Adynovate. They have a half-life of between 12 and 16. What that helps with is for people who are prophylaxing, which is advised at 3 days of infusion, 3 infusions per week, the factor 8 level stays up, so you can continue to be active, versus the previously you would have to infuse more times with a lower half-life or lesser half-life. So this is what is currently available. 2 weeks ago, emicizumab was approved by FDA, and this is a bypassing agent. This fixes factor 9 and factor 10 and continues the pathway, bypassing the need for factor 8. So it's used for factor 8 deficiency patients. The important thing here, this also helps with inhibitor patients. So inhibitor patients are effectively, no factor VIII because it's not effective, even if they have the factor VIII, or if you infuse factor VIII. So inhibitor patients, this is an indication for them to use emicizumab. What's in the pipeline? Fitusiran is in the pipeline. Now this is a chemical. This is actually it's a RNA interfering agent, and its target is antithrombin. Now, so thrombin is it bypasses. It's a common pathway. Thrombin helps with the conversion of fibrinogen to fibrin, and that forms the clot. So when thrombin doesn't exist, then the clot again stops. This is outside the factor 1 through 13. So this is targeting antithrombin. So it's the molecule that is directed by a ligand to the liver and targets antithrombin. So that's the mechanism for that. It is in study. It's an investigational drug right now. 3 months ago, there was a death, and that was directly linked to the clinical trial of fitusiran. So the trial, I think it was phase 2, had stopped very recently by changing the dosing of fitusiran. The trial has restarted, so there is hope. Gene therapy by Biomurali is hitting phase 3 now. This Rani Therapeutics, it's called a Rani pill. I found this 2 days ago, December 5th, maybe 5th. There is a large manufacturer which people might know as Baxter. Now Baxter has been bought by Shire. Shire is if I'm not mistaken, it's an Irish company that helps treat or has products that treat rare diseases like ADHD. So they bought Baxter, or the Baxalta, which is the Hemophilia product division. And they have tied up with Rani Therapeutics, which is a San Jose-based company which specializes in oral biotherapeutics. So my hope is factor VIII, which is a large molecule, will be available in 5-10 years or so in a tablet form or in a capsule form. And the way that their technology works is it goes through the GI into the, it gets absorbed in the intestine. Right now, they're claiming 50% recovery, which is pretty good. They probably have to dose appropriately. But I'm assuming all these technologies are inclusive. What we deal with as patients for all our lives until emicizumab was available, it has always been IV. And IV is not, honestly, IV is not easy. After prophylaxing, infusing 3 times a week, no matter what, to keep your factor level up, your veins get shot. Your veins will not show up. So my hand, both my hands, I infuse on both hands. My veins are not easy to get, especially in a cold place like Chicago. In winter, your veins will not show up. You put your tourniquet, it is hard. And I get really angry, really upset, and I have to go to work, or I have to go somewhere, do something. It is very difficult. So the whole community is waiting for something that does not require IV. Emicizumab is subcutaneous. Fine, it's a needle, but it's nothing like IV. It's much better. So there is progress in this business. Want to say a few words about hemophilia care and where things stand in India. 2 perspectives. One is my perspective from the 60s, huge improvement. From the current perspective, coming from the US, it's in its infancy, but it is getting better. The treatment is very, very urban-centric. So Bangalore has a Bangalore has a center where they treat, but then what happens to patients who have to come from 50 kilometers away? They just don't come because their son or daughter, someone has a bleed. They have to take, a bus, a couple of buses maybe. They have to, with a bleed, imagine with all the pain and all the discomfort and all the trauma and everything. You cannot carry, a person cannot carry a 15-year-old or 20-year-old with a bleed via bus or train or something to come to the center, because that's the only place where factor is available, even if and that for what? You pay your whole annual salary or monthly salary to get one dose and do that whole trek back. That is how life is over here. So there is that. I already talked about the lack of diagnosis, out-of-pocket and infrastructure, everything. And then the psychosocial issues and the taboos. The taboos are what I heard yesterday. The women are getting sidelined. Oh, women with having, they don't become. That just makes my blood boil. What is so different? Yes, everybody has their own problems, but it's a social issue in this country, and I bet it's happening everywhere else also. I'm sure many of you have heard about all the women uprising against sexual harassment in the US in the last 1.5 months. That's been, and I'm glad that something like this is happening. Something like that is going on over here. The opposite of that, rather, the struggles are there. These pictures are from yesterday. Actually, I was at the center. Like these boys, they were telling me, I can't play cricket. I can't play cricket. Why? Oh, if the ball hits my leg, I will have a bleed. 12, 13-year-old boys. If they don't play cricket, I used to play cricket. My parents stopped me from playing cricket, but when I'm in school, they're not there. So I would still play cricket. I'd come back home with a bleed. So be it. I'd put ice, the rice treatment, put ice. Yeah, my knees are boiled. But hey, I did play cricket. I didn't stay. But then that is just how life is. My parents were very liberated, highly liberated. And they took that chance. They said, I live in hope. I live in hope. I've taken some chances. My parents have taken some chances. They just said, there is nothing for you in this country in '89. They said, go. You have an opportunity to make your life in the US. You have friends there. Just go. They had no idea. '89, India was a very close country. Not much news was available from outside, especially from the US. They had no idea what factor or what treatment was going to be available. They took their chances. They took their risks and sent me. And I had to do what I had to do. I had to find the support. My brother followed a few days later, thankfully for me, and he didn't go very far. He was very close to me physically also, about an hour by bus. So we were together pretty much all our lives. And we took our chances, we took our risks, I took my risks, and I made the best out of it. So I always live in hope that things will continue to improve, even for me, but definitely for the younger people. Because I do not want to see like that kid saying, I can't play cricket, I can't swim, I can't. Because I never learned to swim. I never learned to bike. Because my parents would not allow it. They would not. I just had that type of life, because that, now when I look at it, it is harmful. Because once you recover from a bleed or anything like that, you got to get active really fast, or your joint is going to freeze and continue to freeze. So I live in this hope that things will get better for each and every one. And this is not only patients with hemophilia. This is for anybody who has any chronic disease or condition, that they are able to get the support that I got from my friends, from my family, from my co-workers, from the patient community and the patient leaders that everybody is able to get, and that is why I came and I talked to you today. My hope is this, that what I say today does not stay in this room, that either you talk to people outside or start to think, do I know anybody else with something similar? Because many of you, I'm assuming, have not known too much about how it is to live with hemophilia, what challenges anybody faces. That is how deep I wanted to take you today and see how bad or how good it can get. But that support helps a lot, all of you. So thank you very much. Before I let you go, one person I really specially want to thank is Anita Fernandez. She's not here. Hi, Anita. Thanks for all the month and a half of support that you have given to me over the internet. We've never met, but thank you. Second one, of course, Naren, for having me come here onto the stage and talk to all of you wonderful people who've been patiently listening, and for Arindam for having given me a beautiful introduction, and Kriti, I have been emailing them before for organizing this event, and thanks everybody for coming. I'm open to questions.